Okay, good morning, friends. So today we're just gonna talk about actually INNEA AQUA and how it can help you in your clinic practice. So I think first, before we want to start, we just want to introduce, skin boosters in the market is actually, especially the last 2 years, has been going crazy. I mean, skin boosters was very very good in 2013, 2014, and then subsequently it just died down a little bit. And then after that, somehow or other, these last 2 years, it's been just going crazy. I mean, I think probably after that Profilo came out, just started to grow and expand. So in the US they did the study, and then it's bound to increase even more by 2030. And this is actually driven by because of the customers or the clients, the patients have got increased awareness in skincare. They probably have more disposable incomes, growing demand for non-invasive cosmetic procedures, like skin boosters and things. And then the skin boosters, the technology and also the innovations are just coming out day by day, rapidly. And generally skin boosters are designed to improve skin hydration, elasticity, and overall texture. Now, it's actually the addition of the extra ingredients in your HA actually helps in this. Last time when we started skin, skin boosters, it was just pure HA. But with all the technology there, they started adding peptides, they started adding different things to improve the outcome of the skin boosters. Now, generally, it includes hyaluronic acid. Then after that, again, as I mentioned, they include vitamins, antioxidants, amino acids, peptides, all sorts of things they start to innovate and then to improve on the skin boosters, to revitalize the skin. Now, how do I choose? There's so many in the market, but so this is just my personal opinion now, okay? It's not in the studies, as I did so much of skin boosters. For me, it's actually not so much about, which is the best skin booster. I don't think so. All skin boosters are very good. It's a matter of what are the patient's indication and outcome. I mean, they come in with probably pigmentation, dry skin, or itchy skin, or blemishes and things like that. So you then match what the skin booster's capability to your patient's needs. So basically, you can tailor the needs. So a lot of patients will ask me, what is the best skin booster? Actually, there's no such thing as a best skin booster. What is your problem? Is it dryness? Is it flaky skin or whatever? And then you highlight the importance of the additional thing in the HA that will bring the best outcome for your skin. So that's why combination is possible. So in my practice, I usually do combination. So instead of just prescribing one type of skin booster, I often combine and mix different type of skin boosters, because each skin booster has got its own power, has got its own capabilities, So just a quick introduction to HA. Now, it's made from N-acetylglucosamine and D-glucuronic acid, and it's linked by two bonds, the beta-1,3 and beta-1,4. So here, this is basically your basic structure of sodium hyaluronic acid. Now, what is the function? It maintains skin hydration because it can absorb about 1,000 times of its own weight in terms of water. It can revitalize the skin and wrinkles because it plumps up the skin, so your wrinkles looks better. It is compatible with the body. All right, so it gives a natural results, and it helps in the physiological production of collagen. Okay, so but the problem is hyaluronidase is produced in the body and we can inject it, but it's equally removed by the enzyme hyaluronidase. Sorry. So especially when we are talking about non-cross-link, the moment we inject it, technically the pure HA, the moment we inject it, it's cleared within a day. So new HA will be produced of our own body, or we introduce it. In the same time, our body also removes HA. So it's like new one comes in, old one gets removed. So it gets removed. Even when we put exogenous HA, like when we do it, it gets removed. So then, how do we make the HA last a little bit longer? Therefore, they thought about trihalose. So trihalose is basically a disaccharide. It's used in stabilizing food. And then also it's used in skincare, antioxidants, it stabilizes proteins. A lot of things, they use it in the food market. So it stabilizes in terms of the heat and acid, okay? And when you combine it with the HA, it stabilizes the HA. So for example, when the HA is, when the kilang produces the HA and they subject it to sterilization, moist heat especially, sometimes this moist heat can destroy the HA. That means already produced, you put it into the sterilizer and then it gets destroyed. So there must be something that we can add in to then stabilize it, to make sure the efficacy of the HA is good even after when it comes out from production. So this again, trihalose is a water-soluble disaccharide. It sort of like forms a little cocoon or protects the HA from being degraded by heat and acid. So INNEA AQUA comes up with this brilliant idea. So I add HA with trihalose. And I don't only add any HA, I will add medium chain hyaluronic acid. Why medium chain hyaluronic acid? Because medium chain hyaluronic acid is the most compatible with skin. So, and they add in 10 milligram of trihalose. Then after that, they did a study. So it's a very wordy slide. So they did basically one sample is HA, one sample is INNEA AQUA. Both I put hyaluronidase. And I test it from 0 minute to 60 minutes. This is what happens. So at 60 minutes, 54% of the non-trihalose HA got hydrolyzed. So it managed to stabilize this particular HA from being degraded by our own body hyaluronidase. So is it safe for the body? Then they did a study. Okay, so they did all sorts of studies for toxicity, carcinogenicity, and all these things. Okay, and they came up with the conclusion that it is non-toxic. Then it doesn't produce any toxic symptoms when you implant the HA. Very minimal local effects, no systemic effects, and there is no bacterial endotoxins in it, and it's non-mutagenic. So it's actually very compatible and safe to be used. They are now currently doing a study in 2 places, in Milan and also in Italy, and the study actually will be out by 2025 this year. I think we have to contact Ming Lai to ask him when the study will be out lah. Okay, so far anything that you want to ask me? So quite clear, is it?
Just on the 54.1% is versus the other one.
Versus the other one, which
Totally
has
gone.
totally gone. Okay, but let me go back the slides. So basically, this is just the start point. Okay, 54. So at 60 minutes, none of the HA was hydrolyzed with trihalose. 54%
Okay.
without the trihalose got hydrolyzed already.
Half gone.
Half gone already.
Okay.
Within 60 minutes. So can you imagine if you put something is pure HA? Okay, yeah, it's very good, but then it gets removed the first 1 hour of your face. Then no more result already. Right. So of course, when it comes to injecting of INNEA AQUA, there are some anatomical consideration. I think this is very familiar slide for all of us. Okay, basically you want to know where are the arteries of the face, basically your supraorbital, infraorbital, and then also your facial artery. But having said that, when we do skin boosters, we are actually injecting very superficial. So I think it is safe to say that it is very unlikely that you inject into the blood vessel lah. You know, so usually it's this intradermal, deep dermal lah, I would say deep dermal injection. Very unlike. I think probably if you want to be careful of arteries is when you're doing your cannulas, because sometimes when you do your cannulas, the tip, you know, maybe you angle it wrong or things like that. Sometimes it can dip down and maybe touch a cat or pass through an artery and maybe there's some injury, but unlikely. So that's why there are different techniques for INNEA AQUA. So this is quite a versatile depending on what you want. There is multi-bolus. You can also do your linear, and then after that, INNEA AQUA did suggest to do this method. Basically, they target certain certain areas of the face where they target the the ligaments of the face. So basically here you can provide a little bit of a lift and also giving it the hydration. But again, having said that, you will want to do a cross-link hyaluronic acid if you want to give a nice plump lifted look for this particular method. But you can try. The lifting will be there, but it's not going to be last that long compared if you're using a cross-link HA. I would prefer a multi-bolus actually, frankly, because I think it covers all the areas and I know that I'm injecting intradermal. Sometimes if you're using this, if let's say patient who cannot tolerate numb cream, I only want two injection points, I don't want so many points on my face, no downtime, then yes, this method will be very sufficient. But sometimes, personally, I feel that you may not be going intradermal. You probably can be going into subcutaneous and things like that, and then render the whole INNEA AQUA experience no result. So multi-bolus for me is actually my to go. Yes, you may have a little bit of a downtime, but for INNEA AQUA, because it's a total non-cross-link, so it won't create so much of bumps. And I inject it a little bit deeper compared to, like, you know, the really actually blebs that one. So actually the real blebs, like real intradermal, that one will have a bit more downtime. But I inject slightly deeper, deep dermal. So there will be a bump, but it will not last too long. Half an hour will be gone already. Okay? So that would be my preferred method. That basically it's very simple. It's 1 centimeter apart from each point. So you don't want to do it too close because you then not able to cover the next face. Okay. So these are some examples of INNEA AQUA. So basically they did this multi-bolus. I can see that, of course, with HA, the skin gets plumped. Even your scars get, becomes a little less obvious because it's all more plumped up. Okay, everything looks brighter because the light can reflect off a well-hydrated face. It looks brighter. Okay, so here, of course, if you inject it near the nasolabials and things like that, it gets a little bit softer. All right. And then, of course, in scars and then in blemishes, because you're hydrating all these blemishes, it gets a little bit better because it's you're hydrating the whole area. Okay, so basically that's it. That's it about INNEA AQUA. It's a very simple, straightforward. So for me, I like to combine it with something. Probably I combine it with a polynucleotide. Or I combine it with exosome, but you don't mix it together. Basically, you do your your multi-bolus, and then after that, in between, you just put your exosomes, or you just put. So I like to combine. So I have got a double hydration, and on top of that, if let's say for example someone comes in with melasma, you have got certain products with HA and succinic acid. You got certain products HA with polynucleotides. So I want to further hydrate it some more. And I want to add in the power of succinic acid or exosomes to heal the basement membrane or to slow down the melanocyte. I combine it. So it works well. And double hydration works well. And I think in terms of economics, it works well for your clinic as well. So I think this is a very versatile, and it's from Italy. Basically, you do once a month. Now, the reason why, okay, you just imagine when you inject, it's good plasma level already. Not good, what do you call it, skin hydration. And then over time, it starts to dip. Okay? Now, before it finish dipping, you inject one more. So it goes up higher. So that's why they say all skin boosters is 3 months one. Because the moment you add on to the first one, and then after when you finish the third one, right, it takes a little while it takes about 3 to 6 months for it to go off. Before that happen, you're already giving a booster dose already. So that's why all skin boosters, 3 months. Unless you're talking about the newer skin boosters, which is partial cross-linked. Okay, then yeah, you probably want to respect their protocol. But I think it's not wrong for us to also include that, because at the end of the day, this is a non-crossing, safe. It's definitely going to be hydrolyzed oftening, and the effects is going to be there. The consistency is actually very liquid, so it's easy to inject. So it's like some certain skin boosters is very thick. This INNEA AQUA is not so, it's actually very extrusion, especially for ladies. The extrusion force is not so bad. So sometimes I can go 30 gauge. 30 gauge. I use 30 gauge. If let's say if it's still too hard, then you can go 29. You go 29. For cannula, usually I go 25. But 25 you have to be careful, because the extrusion is so low, suddenly too much come out. So you have to really, really be very careful. That's why I use multi-bolus better. Sometimes if you're not really used to the what do you call it, the extrusion force, you do, no more, half gone already. So because I usually use 25. I used to use 27. But then again, as I practice, my cannula size bigger and bigger and bigger. So last time I used 27. Last time I always used 27. Oh, 27 is good, 27 is good. Now it's 25, 22. No more 27 already. Scared. Okay, I guess any questions? Any questions so far? Okay, yeah, clear, right? So I guess now is your experience with the product, and then you see how it goes.
The official recommendation is once a month for 3 times.
Actually, the official recommendation is every 2 weeks.
Oh, every 2 weeks?
Every 2 weeks, for I think 4 sessions. I think every 2 weeks for 4 sessions. But I think sometimes for our patients, every 2 weeks is like a little bit. It's a bit too it's too frequent, and then like, why is it every 2 weeks? But I think 3 times, once a month, I think is what do you call it? I think it's reasonable lah. And if let's say, for example, you're going to combine it with another different type of skin boosters with a different capability, I guess you can do once a month.